Occupational English Test. Listening Test. This test has 3 parts. In each part, you'll hear a number of different extracts. At the start of each extract, you'll hear this sound. You'll have time to read the questions before you hear each extract, and you'll hear each extract once only. Complete your answers as you listen. At the end of the test, you'll have 2 minutes to check your answers. Part A. In this part of the test, you'll hear 2 different extracts. In each extract, a health professional is talking to a patient. For questions 1 to 24, complete the notes with information you hear. Now, look at the notes for extract 1.
Extract 1. Questions 1 to 12.
For questions 1 to 12, complete the notes with a word or short phrase. You now have 30 seconds to look at the notes.
Hi Hannah, nice to meet you.
Hi.
So I understand that you were referred to me by your GP because you've been experiencing some anxiety difficulties.
Yeah. I guess it kind of started like 5-6 years ago.
Okay.
It escalated a bit. I've just recently moved out from living with my parents, so it's made it a bit worse, I think.
Okay, is this the first time that you've left home?
Yeah, it is the first time actually, yeah. I was going to a few years ago, I just thought it would be easier to stay home, so.
Okay, so it's been quite a big step and a big change, and it sounds like that was what led you to go to your GP.
Yeah.
So how has that changed things for you?
Do you know, it's kind of, I haven't really told anyone, so, I mean, it's made it like better in the sense that I feel hopefully this is it, like it'll help, but I don't know, I don't like thinking that I've had to do this. I never thought I'd be the kind of person who'd have to actually go and get help, if that makes sense.
Okay, so how do you feel about being here today?
A bit scared, I don't know, hopefully it will help.
Okay, so you've been feeling a little bit anxious about today?
Yeah.
Okay, so I guess just going back to why you went to the GP and how you've ended up kind of coming here today. So it sounds like you've been experiencing anxiety for quite a few years, but just recently you moved out of home for the first time, and that was what kind of led you to go to the GP. So how did that change things? How were things after you moved out?
I thought that they'd be better, but because I thought I'd have to kind of be independent, but it's actually a lot worse. I'm just kind of staying in the house a lot. I don't really have any friends or anything. I mean, my family come and visit a bit, but it's not, I don't know, it's kind of scary because I've just been kind of literally just in the flat by myself, which I always thought I'd like, but I don't actually like it.
Okay. So what are the kind of difficulties that you have been experiencing?
I mean, I'm a photographer, so I kind of, it's been stopping me a bit, my anxiety, from being able to get work, and because every time, you know, there's an opportunity that is kind of involving me having to interact with people, I just tend to just turn it down. So I was kind of making things hard in that respect, and just kind of friends-wise and everything, I just feel like I'm just kind of increasingly more alone. So it's kind of stopping me from making friends and, you know, relationships and stuff.
Okay, so you said that your difficulties are getting in the way of you doing certain things, so they're stopping you from taking up kind of certain types of work, and as a freelance photographer, I guess that can be kind of a problem. And they're also stopping you, or you feel like it's stunting you socially. You're not kind of able to make new friends and get to meet new people.
It was kind of easier when I was at home, because I was obviously, I mean, my parents and stuff, that's fine, but you know, I'd go to places with them, or I'd kind of have people there, but more and more I'm just finding myself just staying in a lot. I mean, I went like 2 weeks ago for coffee with my friends, and the whole time I was just kind of wanting to go home again. So I don't want that to happen. I don't want to lose everyone.
So you're kind of worried about where this is going to lead to?
Yeah.
Okay. So you said that you first noticed the anxiety kicking in when about 5 or 6 years ago.
Yeah.
So you would have been about 19?
Yeah.
And what was happening around that time?
I guess I'd finished school about a year before that. And I mean, I've always been a bit shy at school, but it was never ever, like it didn't really affect things as much as, not at all as much as it has been doing the last few years, I guess. It just started when like my friends went to university, and I don't know, I felt like I was expected to kind of move out or just do something, and then it just kind of escalated from there. I'd just stop going to parties, or I'd just say no to invitations, or I don't know, I thought my job would help, because I mean, I love it. I really like doing photography, but I'm just kind of getting less and less work as it goes on. So, which is my fault, I keep saying no. But
what kind of work is the most difficult for you in your job?
I guess when I have to kind of be working with other people. I don't like that. It's like when I'm trying to kind of do an event or something where there's a lot of people there, not just photographers, but actual, you know, if I'm like taking photos of people, that, I don't know, I just kind of find myself saying no. I mean, I want to do them, but just it's scary, so I just don't do it.
So I guess tell me a bit more about what happens then. So let's focus on maybe an invitation to do a job with, you know, it's going to involve photography with a group of people, and you're going to have social interaction. What kind of thoughts go through your head?
I mean, I get really hot and sweaty, and I feel like everyone's kind of looking at me and thinking that I'm just like really stupid, and I feel like they're all going to be staring and thinking I just can't do my job and I'm just an idiot, and I mean, they'll think that I just look like a weirdo, and I just kind of just try and get out of the situation or just focus on something else. So that's why I like doing shots where it's just me and the camera, because then I can just put all my attention on that instead of having to, you know, be with other people.
Okay, so it sounds like you have quite a lot of thoughts rushing through your head then at the point where you get that invitation. You think, people will look, people will stare, people will think I'm a weirdo. So there's quite a lot about what you think other people will think.
Yeah.
And how does that make you feel?
Just makes me feel like an idiot. It makes me feel like I just shouldn't even bother trying to do it anymore. I should just go home, and I think I just don't want to be in that situation. I just feel like everyone else is fine and they're normal, and I'm just the freak who can't like do normal things. And
okay.
Extract 2. Questions 13 to 24. You hear a physician talking to a new patient called Mrs. Delilah. For questions 13 to 24, complete the following notes with a word or short phrase. You now have 30 seconds to look at the notes.
Good morning, doctor.
Good morning. What's your problem?
Well, I have persistent mild weakness in the left leg and occasional off and on numbness in the left hand. I have shortness of breath often.
Do you feel any weakness in your arm?
No, doctor, but I am ambulating with a cane.
Was there any history of falling down?
No, doctor. I had repeat carotid Dopplers and further imaging studies which shows no further increased stenosis in my left internal carotid artery.
Okay. What is your age?
51, doctor.
You had any illness and treatments?
Yes, I had cerebrovascular accident but got treated.
What medications are you taking?
Plavix, aspirin, levothyroxine, lisinopril, hydrochlorothiazide, Lasix, insulin, and simvastatin.
Any allergies due to medications?
No, doctor.
Is there any history of illness of your family members?
No, doctor.
Well, your blood pressure is 170/66, heart rate 66, respiratory rate 16, your weight is 254 pounds, and your temperature is 98. Normal cephalic and atraumatic, no dry mouth, no palpable cervical lymph nodes. Your conjunctiva and sclera were clear. Your cranial nerves show mild decrease in the left nasolabial fold. There is a mild increased tone in the left upper extremity. Deltoid shows 5/5. The rest shows full strength. Hip flexion is 5/5 on the left. The rest shows full strength. Reflexes were hypoactive and symmetrical. Your gait is mildly abnormal. No ataxia noted. Wide-based, ambulated with a cane. Status: post-cerebrovascular accident involving the right upper pons extending into the right cerebral pedicle, with a mild left hemiparenthesis. Status: post-cerebrovascular accident involving the right upper pons extending into the right cerebral peduncle, with a mild left hemiparesis, has been clinically stable with mild improvement. For now, continue using antiplatelet therapy and statin therapy to reduce the risk of future strokes. Continue to follow with endocrinology for diabetes and thyroid problems. You must strictly control your blood sugar level, optimizing cholesterol and blood pressure control, regular exercise, and healthy diet. I am planning for surgical intervention for the internal carotid artery. This is the end of Part A. Now, look at Part B. Part B. In this part of the test, you will hear 6 different extracts. In each extract, you'll hear people talking in a different healthcare environment. For questions 25 to 30, choose the answer A, B, or C, which fits best according to what you hear. You will have time to read each question before you listen. Complete the answers as you listen to the audio. Now, look at the question 25. You hear a discussion between a doctor and nurse about different types of blood tests for leukemia. Now, read the question.
Hello, doctor. What are the different types of blood tests for leukemia?
Well, blood tests, such as complete blood count, can detect leukemia. A complete blood count determines the number of red blood cells, white blood cells, and platelets. Cytogenetics analysis is a blood test in which a sample of blood is examined to check for changes in the chromosomes of the lymphocytes. Peripheral blood smear determines the presence of blast cells and shows the type and quantity of white blood cells. Other various blood tests may be ordered to see how organs are functioning and if they're being affected by leukemia. Question 26. You hear a discussion about different types of melanoma. Now, read the question. There are 4 major types of melanoma that have the potential for metastitis, with distinct characteristics. Lentigo maligna is often found on the head and neck region. Superficial spreading melanoma is more commonly found on the trunk, upper arms, and thighs, and is the most common form of melanoma in white races. Acrolatiginous melanoma is more commonly found on the hands, feet, and nail beds, which is similar to lentigo maligna and superficial spreading, in which it has a relatively long, flat phase before it penetrates into the deeper levels of the skin. Nodular melanoma can occur on any skin surface, but is found more commonly on the trunk, upper arms, and thighs. Question 27. You hear a discussion about lung cancer. Now, read the question.
Hello, doctor. What are the different types of lung cancer?
Squamous cell carcinoma, or epidermic carcinoma, usually starts in the bronchial tubes in the center of the lungs and can cause symptoms early on, especially hematypus. Large cell carcinoma often occurs in the outer regions of the lungs and tends to grow rapidly. Mesothelioma actually begins in the mesothelium, a membrane that surrounds the lungs. Small cell lung cancer usually grows in the central areas of the lungs, and most people have few symptoms until just before they are diagnosed. Lung carcinoid tumors are made up of cells called neuroendocrine cells. Question 28. You hear a discussion about non-inflamed comedones. Now read the question.
Hello, doctor. Can you please explain to me what are non-inflamed comedones?
With non-inflamed comedones, there will not be redness or swelling of the lesion. However, non-inflamed comedones may turn into a pimple when bacteria invade. Open comedones, or blackheads, is an accumulation of dead skin cells and sebaceous matter within the follicle. Soft closed comedones develop when a plug of cellulose debris and oil becomes trapped within the pore and are covered by a layer of dead skin cells. Hard closed comedone, called milia, have very obvious whiteheads, which is not pus but rather a mass of dead cells and sebum. Microcomedones occur when the sebaceous duct and pore opening becomes blocked by excess sebum and dead skin cells. Every blemish begins as a microcomedone. Question 29. You hear a question about acnes. Now read the question.
Hello, doctor. Could you explain to me what are acnes?
Well, there are different types of acne which are not just classified by its severity. Acne vulgaris can appear on the face, back, shoulders, and buttocks. If you break out, most likely it is the acne vulgaris comedomal acne. Appears as bumpiness, blackheads, which can occur anywhere on the face or body that can range from very mild to quite severe. Cystic acne is the most severe form of acne, which can occur anywhere on the face or body. Acne cysts occur deeper in the skin than the typical pimple, take weeks to heal, and can cause a lot of damage to the skin. Because they are so deep, topical acne treatments are not very effective. Instead, oral medications, like Accutane, are the best option. Nodule acne is another severe type of acne vulgaris. Acne rosacea is a type of acne that affects adults above 30 and occurs only on the face. Acne machantia is caused when there is excess heat, pressure, or friction on the skin. This type of acne is most common on the body, but can also occur on the face. Acne cosmetica is caused by products like creams, makeups, and moisturizers, and even certain hair care products cause this type of facial acne. People with excoriated acne chronically and excessively pick at pimples to the point of causing wounds. Question 30. You hear a discussion about athlete's foot. Now, read the question.
Hello, doctor. What are the different types of athlete's foot?
Athlete's foot is divided into three categories: chronic interdigital athlete's foot, chronic scaly athlete's foot, and acute vestibular athlete's foot. Chronic interdigital athlete's foot is characterized by scaling, maceration, and fissures, most commonly in the webbed spaces between the fourth and fifth toes. With this type of athlete's foot, itching is typically most intense when the socks and shoes are removed. Acute vesicular athlete's foot is the least common type of athlete's foot, caused by trichophyton mentagrophytes, that is characterized by the sudden onset of painful blisters on the sole or top of the foot. This type of athlete's foot is also caused by jungle rot, a historically disabling problem for servicemen fighting in warm, humid conditions. Chronic scaly athlete's foot is caused by Trichophyton rubrum. This dermatophyte causes dry, scaly skin on the sole of the foot. The hands may also be infected, although the usual pattern of infection is 2 feet and 1 hand, or 1 foot and 2 hands, and these are most commonly seen in patients with eczema or asthma.
That is the end of Part B. Now look at Part C. Part C. In this part of the test, you'll hear 2 different extracts. In each extract, you'll hear health professionals talking about aspects of their work. For questions 31 to 42, choose the answer A, B, or C, which fits best according to what you hear. Complete your answers as you listen. Now look at Extract 1. Extract 1, questions 31 to 36. You now have 90 seconds to read questions 31 to 36.
Tell me a little bit about the progress in the plant-based movement recently.
There's been tremendous progress, particularly in the health field. At least that's certainly my perspective. So in the States, there's just been a real surge, a real tipping point in terms of the plant-based nutrition movement. There are now entire conferences. There's an international plant-based nutrition healthcare conference. Hundreds of physicians, other medical professionals get together, talk about how they're using this in their practice. I mean, that didn't exist a few years ago. I mean, it's really, really exciting. There's new vegan medical clinics opening up where all the folks on staff are using lifestyle medicine approaches, not just to prevent disease, but to stop and reverse it as well.
Tell me about the main players involved. You've got Nutrition Facts growing, you've got the Physicians Committee doing a lot of work. Who are the main players and what's been achieved specifically in the last few months and last year? What's been the memorable moment for you?
Well, so, you know, a lot of people don't know about Scott Stoll, who started this, PBNHC, this Plantrition project, this plant-based nutrition conference. He's been doing these immersion programs for Whole Foods for a long time now. He has a book coming out.
Okay.
I'm very excited about that. He's just had transformative experiences. You know, he's just a physician in practice. There's people all over who've been doing this in their own little, you know, hometowns. But it's just great to get so many people together, start networking. So there's wonderful resources out now, documentaries. You know, we got a number of documentaries coming up, like The Game Changers and Eat Yourself Alive. And I mean, it's just, this is an exciting time to be in the movement. And I think, you know, a lot of it is just there's so much, I mean, we're going to get there if only because the healthcare costs are spiraling out of control, right? Climate change. I mean, we're just going to be forced to have to take these, you know, safe, simple, side effect-free solutions, cheaper, safer, more effective than conventional medical approaches, because we're talking about the leading killers, right? The leading cause of death. I mean, the good news is that the vast majority of premature death and disability is preventable with a plant-based diet and other healthy lifestyle behaviors. We have the power, we have tremendous power over our medical destiny and longevity.
You talk passionately about the benefits of plant-based diet, particularly reversing heart disease. My old boss, he was a professor of epidemiology called Professor Tim Spector. He said he met Dr. Dean Ornish. Dr. Dean Ornish said, the thing with the plant-based movement is you get the sense you're either with them or against them. We're going to talk about that in a minute. But also what he said was there aren't any large randomised control trials. He said, Dr. Dean Ornish, show me the large randomised... Why aren't there any? If we've known about this since Pritikin's day, where's the data, the large randomised control trials?
Well, look, I mean, Ornish published his first RCT, randomised control trial, July 1990 in The Lancet, the most prestigious medical journal in the world. There it was, black and white, proving with quantitative angiography that we can reverse heart disease, open up arteries without drugs, without surgery, just a healthy plant-based diet and other lifestyle changes. There it was. Right? So we've known about it for decades, but there it was, published in some of the most prestigious medical journals in the world, The Lancet, JAMA, yet what happened? Nothing. Hundreds of thousands of people continue to die of a reversible, preventable disease.
So it's being ignored.
It's being lost down the rabbit hole and ignored. I said, well, wait a second. If effectively the cure to our number one killer could get lost like that, what else is there on the medical literature that could help my patients, but just didn't have a corporate budget driving its promotion? I made it my life's mission to find out. That's why I started nutritionfacts.org, and that's why I wrote my new book, How Not to Die.
What I find very interesting is you say the system needs to take on board this message, but the whole point of Nutrition Facts was to go round the system. Tell me a little bit about the democratization of information and the role that's played and why that's been good for the movement, I guess.
You know, when I started out ignoring the general public and going straight, you know, trying to train the trainers effectively, going around speaking at all the medical schools in the States to try to, you know, get the next generation of doctors educated. But then I realized that's a slow way about it. We don't have time. People are dying now. I don't need to, you know, for another 10 years for them to kind of slowly take over the medical system. People are dying now. We need to take this directly to the people. And thankfully, thanks to the internet age, we now have this democratization of information. Now everyone has access. Before, the doctors had a monopoly on information about health. And so, big pharma, the food industry, all they had to do is get to the doctors. The tobacco industry, as long as they could get the AMA on board by writing them checks for $10 million, and so they came out opposed to the Surgeon General's report against smoking in 1964. As long as they control the doctors, they control the health message. No longer. Now, people can get to the science directly, educate themselves, and we can't wait until society catches up to the science because it's a matter of life and death.
USDA, I've read their mission is to expand markets for agricultural products. But at the same time, they're coming out with the dietary guidelines. Is that one of the challenges you have in the States?
The USDA has an inherent conflict of interest. The U.S. Department of Agriculture, look, the same thing happened here in Great Britain. Right, there was the Ministry of Food and Forestry, right? And then the mad cow debacle came, and they basically dissolved the department, right? put food safety in charge of medical professionals in charge of food safety instead of agricultural professionals. Same conflict of interest exists in the States. U.S. Department of Agriculture has this dual mission to promote agricultural products. That's what they're there for. But also, we put them in charge of food safety, meat inspections, helping to come up with the nutrition guidelines. So when it comes to eat more messaging, the message is clear. Eat more fruits and vegetables. There it is, right there in black and white in the dietary guidelines. But what about eat less messaging? Then there's a conflict. So what do you get? Instead of eat less meat, eggs, dairy, junk, what do they say? Eat less saturated and trans fatty acids, things like that. Biochemical components, right? Because they don't want to mention foods because that's too politically unpalatable.
But they'll mention vegetables, they'll mention fruits.
Well, they'll mention fruits and vegetables because it's an eat more messaging. Yeah. Everybody's happy. Promote agricultural products and promote health. If they can do it without undermining the profit motive, they'd be happy to make the American public healthier.
Can you just explain a little bit about how corrupt the medical industry is in the US? It's kind of related to what you talked about already.
Well, there's a number of barriers for doctors. So you say, okay, we understand why some of the mainstream medical associations are sucking up to industry because they're being sponsored by Big Pharma, for example. But why aren't individual doctors speaking out? Well, there's a severe nutrition deficiency in doctors in education. We just weren't taught this in medical school, so we graduate without these powerful tools in our medical toolbox. We just weren't taught how to teach people to take better care of themselves, right? But of course, there's other barriers. There's lack of time, lack of reimbursement. Doctors aren't paid to tell people how to take better care of themselves. And also, there's much of medical education, both during medical school and postgraduate medical education, is paid for by the drug industry. I mean, the number one reason people go to their doctor in North America is what are called blood pressure checks. And they keep going to get their blood pressure checked so they can tweak the blood pressure medications. And so that's a boon not only to Big Pharma, which sell these chronic disease drugs that people take every single day for the rest of their lives because they're not actually treating the cause of their disease, right? Because they're not actually changing their diet. So they need to be treated every day for the rest of their life. So it's a boon to the Big Pharma, but also that's where the doctor's getting their next BMW from and sending their kids to college. I mean, it's the bread and butter of the GPs, of the primary care docs, is these blood pressure checks, which wouldn't be necessary if they didn't have high blood pressure. The number one killer risk factor in the world, 9 million people dying of high blood pressure, a disease that need not occur if people ate plant-based diet, something we've known since the 1920s.
Now look at Extract 2. Extract 2, questions 37 to 42. You now have 90 seconds to read questions 37 to 42.
We've been studying a disorder called seasonal affective disorder. Norman Rosenthal first identified this disorder in the mid-'80s. The theory is that a decrease in light during the long winter months may be responsible for triggering a chemical imbalance that in turn may cause depression among those people with a predisposition to depression. Supposedly there's an area of the brain called the suprachiasmatic nucleus, which is very close to the retina of the eye. So this area of the brain responds to light by sending a signal to the pineal gland, and the signal causes the gland to suppress a secretion of a hormone called melatonin. To make a long story short, the more light, the less melatonin in the blood. Okay, the acronym for seasonal affective disorder that's being used in the field is SAD. We didn't come up with that. And in fact, I personally think that it's an inappropriate way to refer to such a serious type of depression, since it sounds rather mild, and seasonal affective disorder can be a very severe and debilitating disorder for some people. In fact, in extreme cases, it's life-threatening when patients become suicidal. So anyway, as you can appreciate, the winter here is very dark, cold, and gray. By spring, almost everyone's tired of the gloom. But for some people, those suffering with seasonal affective disorder, it can be a serious problem. People with seasonal affective disorder experience deep and prolonged depression throughout the winter months, with what looks like a spontaneous alleviation of the condition when spring arrives. Before the disorder was identified, it was rather a mystery for friends and family, since the depression appeared to vanish only to return several months later. Now, although previous research isn't conclusive, we do know that younger people, especially younger women, these women are at a higher risk for developing the disorder and for being affected by it in a more severe form. If I recall, about 75% of those affected are women, with a typical age of onset about 30 years old. Other factors that contribute to the problem, apart from the long dark days, of course, these factors include heredity and stress. What are the symptoms? Well, the usual spectrum of problems associated with depression: anxiety, lack of concentration, a tendency to sleep more and eat more, cravings for food with a high sugar content. This may be accompanied by weight gain. On the other hand, some people actually lose their appetites and tend to lose a significant amount of weight. We also see lower energy levels, and for some people, a dull headache may accompany the problem. So, building on the research studies that identified the symptoms of seasonal affective disorder and the high-risk profile, we decided to undertake a longitudinal study of 120 subjects, and our research is really focusing on therapies that might help those people affected by SAD. Traditionally, psychotherapy has been used to identify and modify behaviors that contribute to depression, and it's been somewhat successful with patients identified with seasonal affective disorder, especially when used in combination with relaxation and stress reduction therapies. Antidepressant drug therapy has also been proven to reduce depression in studies of people who had seasonal disorders. But we've been using phototherapy almost exclusively with the subjects in our studies. It's very simple, really. We've supplied each subject with a light box that provides the same type of natural lighting that would normally be shining through the window during the spring and summer. The subjects have been instructed to turn on the light box for 2 hours and then simply go about their activities in the room where the box is placed. They're not supposed to use the box like a sun lamp, no staring into the light, either with the eyes closed or open. They just ignore it once it's turned on. So, although we're still evaluating our data from the first group of subjects, we have a few preliminary findings that I'll share with you today. First, we think that it's probably better to be exposed to the light box during the morning hours. Second, we're noticing a relationship between sleep patterns and seasonal depression, so maintaining a regular schedule for sleep seems to be a helpful therapy in conjunction with the light treatment. We're also fairly sure that the duration of light therapy can be modified for individuals. Some subjects who were exposed to the light for less than 2 hours did very well, while others showed no evidence of relief until they reestablished the 2-hour treatments. One interesting possibility that we're working on is whether fluorescent lights might work as well as full-spectrum light with the ultraviolet rays filtered out. In our first trials, we used UV light exclusively, but now we have some trials underway with fluorescent light, and the results so far are encouraging. I'm also happy to report that there are few subjects who are experiencing side effects. There's no evidence of eye damage. We've been careful to filter out any potentially damaging UV rays. And in fact, the only negative side effect was minor headache that seemed to disappear after a few treatments. So next semester, we plan to begin the second stage of our studies, and we'll be comparing the degree of depression on the part of subjects undergoing light treatments with control groups who'll receive either drug treatments or psychotherapy. What we really want to know is whether light treatments alone are as effective as the other options for therapy.